Well, hello and welcome to the Mindful Medics podcast, where we dive into the lives of medical professionals, exploring the triumphs and trials of their careers, and uncover how they have found ways to manage stress, prevent burnout, and to thrive, both professionally and personally. Join us as we discover the keys to a balanced, fulfilled, and healthy life in this crazy, demanding world in which we live. Today's guest is Dr. Mona Amini, a board-certified psychiatrist and founder of Monv Mind Wellness, where mental health care is approached with sophistication and precision. Her practice specializes in personalized treatment plans tailored to each patient's unique needs from the very beginning. With extensive experience, Dr. Amini builds deep empathic connections with her patients. She collaborates to create customized strategies that incorporate medication therapy, lab work, and personalized habits, helping individuals achieve their goals. Monv Mind Wellness redefines traditional psychiatry, offering a luxury experience that integrates attention to detail with a long-term commitment to optimal mental well-being. So welcome to the show.
Thank you so much for having me today.
Wonderful. So tell us first a little bit about your early life and what inspired you to pursue a career in medicine.
Absolutely. I was always taken to the field of medicine since I was a young child. Definitely did not know exactly where that would lead me. But along the way through college and in medical school and prior to med school, I knew that I really loved the mind, loved having that experience of the mind-body connection, and chose the path into psychiatry very early on in my med school career. So that just evolved into the route into where I am today, and very grateful that it had taken me to that point.
Wonderful, wonderful. So it sounds like it was a fairly simple decision for you. It was, yeah, that's wonderful, because a lot of people, they try one specialty and then they're like, no, I don't love this. And then they try another. So that is wonderful to hear. It was clearly, your destiny to become a psychiatrist. I love that. So tell us, did you have any challenges during your medical training or your career? And if so, how did you overcome them?
So I think all of us have challenges through the course of our careers and, through our journeys in life. Medical school in and of itself is not an easy journey. I was very grateful to have a husband that was on the journey with me at the same time with me. We actually went through med school together. We couples matched in different specialties, but in the same city and actually the same institution. But the medical school is not something for the faint at heart. You really, really have to be very keen on what you want to do in your life. And like you had said, almost feel like that is fulfilling a destiny. It's not an easy experience. And we had ended up moving through different cities and different states, just, with our clinical experiences and journeys along the path, which is not very easy. But when you're together, I think that is a more gratifying experience. And you have a built-in study partner ultimately at the end of the day. But I also noticed in my third and fourth year of medical school, when you start engaging in more clinical hands-on experiences, that there were a lot of tendencies of different specialists and even just, within the hospitalist range of having stereotypical bias against psychiatric patients. Somebody who attempted suicide in the ER, for example, and the ER physician would just, negate anything and everything that individual was saying. And all I heard was they're just reaching out. They just really want to be heard. They want to be listened to. They need an empath. They don't want somebody who's judging that entirety of their decision, unfortunately, to attempt to complete suicide. So I really became much more involved in that. I really enjoyed consultation and liaison in the medical hospital setting for some time in my career for that very reason. And so through the course of these different, journeys of medical school and clinical rotations, residency, you just have to understand that you yourself have to evolve and be very resilient in both your mindset and what you're doing in your life to kind of fit in some of that hobbies or creativity to offset a lot of like the medical science, biological background that you're constantly inundated with.
Yeah, absolutely. I really resonated with what you were saying. I did, I did a psychiatry rotation as a medical student, but I knew that I couldn't do it as a career because I found it really hard to cope with. It affected my own mental health. I'd be thinking about the patients too much. I'd be worrying about them, and psychiatry is a very, very complicated field. I also loved what you said about the other hospital doctors, not really understanding the psychiatric patient. And I think often they would just, my experience was a lot of doctors would just find these people, annoying and, why
Yes.
can't they answer a question straight?
Yeah.
And would see it as, as this person being difficult, when you and I both know it's, it's a mental health problem that patient did not choose to have. Nobody chooses to have mental health problems, and it should be treated just the same as if somebody has diabetes or another illness. And I think, do you see that changing, that kind of attitude towards psychiatric patients, or do you still think there's a stigma there?
I think it's getting better. I think that society, and this is around the world, it's not just in the United States, but I think society around the world has shifted to really understanding the propensity of mental health to really affect you. And that's not just mentally, but it's absolutely physically. It's within your life, your profession, your partnerships, whatever relationships you choose to have. And social media and media in general, I think, has a big part in that. That's actually the reason why I started kind of my process in social media and thought leadership, for that very, very reason, because I wanted people to understand that mental health is health. It's not one or the other. I think there's always been a division within even our insurance payer space in the United States here, that no, it's one or the other. It's kind of like dentistry and physical health, and all of these things are very divisive, and it's not. They're all intertwined. They're very much connected. I don't think we're at a point where everyone is able or apt to talking about it in their own, subset of their families, friends, and circles. But I think it's gotten a lot better, even within the course of my trajectory of my career, within a span of just a little over 10 years after residency. The talk has shifted, and I think a lot of that was unfortunate circumstances with COVID and the
Yeah.
pandemic. But because of that isolation, because we saw so much anxiety and depression and all of the things that came about from that process of staying at home, not really having human to human, true physical interaction in person, we saw a lot of these issues come about, and more celebrities are talking about it. Athletics and athletic organizations are talking about these things more, which are really bringing it much more to the surface, lessening the stigma, lessening it as a weakness or an issue with an individual, and making it more something that can be talked about easily
Absolutely.
within human to human interaction.
Yeah. And I love what you're doing on social media. I've been
Thank
following you
you.
since we met a couple of months ago, and everybody who's listening should check out Dr. Amini on Instagram. I'm following you on Instagram. Are you elsewhere?
Yeah.
Are you on TikTok or
I
not?
am. I'm not on TikTok yet.
Yeah.
Potentially in the works. We'll see what happens in January here in the
Yes,
US, if
indeed.
it will still be a platform to utilize. But I'm on LinkedIn and Instagram, but most of my content is through Instagram that you'll see.
Yeah. And you're doing a great job. And I'm
Thank
aware
you.
that you talk a lot about redefining psychiatry. So let's
Yes.
talk a little bit about why it needs redefining. What are the problems in psychiatry, and how are you working to change the narrative?
I feel that just psychiatry in general. You had mentioned your personal experiences, in education and through med school. I think that, taking a step back, when I looked at residency and just psychiatry in general, I was wrapping my head around the entire human, the person, not just a diagnosis, not just utilizing medications to manage mental health symptoms. And I think we've kind of stepped away from that. We're looking at the propensity of innovative tools and, medications and interventions, which are really great. I am not to denying that these are really helpful tools, but we also want to take a step back and really understand that the human in front of us is an actual human. There was a timeline of events that brought them to your office at that given day, and they need therapy. They need education. They sometimes need mediation about their professional or partnership, romantic relationships. And I feel that because psychiatry is led into more of these, what is going to be paid for by insurance payers and these different types of healthcare systems, we're throwing instant gratification tools, which are much more medications or, these types of supplemental treatments, not actually educating the patient on lifestyle changes and diet and the importance of physical exercise, different evolutions and their seasons of life and what that means hormonally, physically, engaging in these types of subsets of symptoms and behaviors and addressing those accordingly with them. Um, so that's why I kind of wanted it to be more of an innovative tool where the systems at hand really, maybe we go back into a space where we're actually using augmentation of talk therapy and medications, maybe talking about supplementation with other types of, nutritional supplements, using just the tried and true tools of lifestyle and having that engaging conversation with them, not just saying that this is a DSM-5 diagnosis and here's where we're treating you and for this reason for this amount of time. You can have performance measures and KPIs and all of these strategies at any given time utilized for a patient. But the way that we treat patients in psychiatry and mental health in general is not going to equivocate to how an internist treats hypertension or diabetes. Unfortunately, it's not as objective. So we have to use like our objective heads and minds at treating each patient more on like a whole person level.
Absolutely. And I think, when you were talking about kind of the assessment of the whole person, my experience with seeing psychiatrists, myself, I had a long history of anxiety and depression. I sadly had experiences where the psychiatrists I was seeing didn't ever ask about lifestyle, barely asked about family history, but certainly didn't dig deep. It was how quickly can we get this person in and out, and with a medication, and pat them on the head and tell them to go away, and and I love what you're saying, and I think there is a change happening in medicine in general, with integrative medicine becoming more popular, or holistic medicine, whatever you want to call it, lifestyle medicine, of seeing the whole person. And as you and I both know, the organ that's affected in psychiatry is the brain. And, we need to be seeing this as an organ that's struggling, and, we need to assess it, and we need to give it holistic treatment,
Absolutely.
So I love what you're doing, and I think it's very refreshing to hear that. You hear so many stories about psychiatrists like I saw, who are just, pill pushers effectively.
Yeah. And I really, unfortunately, I really, really hate that, that is still occurring in the community. And, if I can help be one of the pillars of change for that, to help mentor or excite other psychiatrists that are coming out into their blossoming careers to make it into a very different direction and actually treat patients in this manner, that to me is really pivotal.
Absolutely, it can make a huge change in the world, and in medicine as well. So tell me, we all know that people in the medical profession have higher rates of mental illness themselves, high rates of anxiety, depression, and also of addiction. So tell me, is there any advice that you would give to somebody who is starting off in their career in medicine, what they can do to kind of protect their mental health, and maybe, talk a little bit about, what signs they should look out for that are red flags that they need to start getting some help?
Absolutely. This is actually really, really key, especially now in today's society with the medical training. And our rates of burnout have just shot through the roof, especially during COVID and thereafter. One of the things that I always educate people on, that are, professionals within my practice or subset of, network, is having at least some tools where these are creative or hobby outlets that you have on the side. We are not meant to be put on this earth to work 24/7. And I think
Yeah.
that sometimes, because a lot of us went into medicine and into the field for the simple reason that we're empaths or we care and we're wanting to deliver that kindness. It's not to become a trillionaire bill, or, because we're not going to make that much income from all of this, obviously. So we, at our very nature, put in a lot of ourselves into our career. We chose that for a very reason. But that doesn't mean that you have to be in that mindset every single day for 24 hours of your day. So, what are some of the types of things that you can fill into that day, that is more of like what we call in the community self care? That self care for everyone means something different. For me, it would mean something very different than my husband, than yourself as well. But what are some of those tools? It could be physical exercise. It could be simply having a date night with your partner every single, Friday, and making sure that that is fit into your schedule. Hobbies, things that are very much of your mental outlet that you can look forward to on a daily or weekly or whatever basis. Having really great friendships and networks of people that surround you, that uplift you, that elevate you, that are like minded, that are not going to be draining,
Yeah.
because you really have to have support in your life in general. It's not just as a physician in your career, but you want people that have an understanding and engagement of what you're going through every single day. Um, and it's hard when you're in private practice because sometimes you feel alone, you're isolated, you don't really have
Yeah.
anyone else to turn to. But it doesn't mean that you can't fulfill that with other networks of different colleagues and therapists. For example, I have many different therapists, social workers, psychologists, psychiatrists, friends, colleagues that we have chat groups, for example. And sometimes we're just putting something funny in there, like a meme, or we're just offering support to one another about, what's going on in terms of their life and practice. And, one of the things that I think that we miss out on in med school and just in residency and everything in general in our careers is we can't be sedentary. You really need to be physically active. You have to have some sort of, um, outlet in terms of physical activity because it's a high stress environment. Doesn't matter your specialty. Again, you're giving so much of yourself, so much of your mind and brain and effort every single day in clinical or administrative practice. So ensuring that you're physically sound is much more important than anything else because we age and we're not inevitably, going to be young forever.
Mhm.
And so a lot of what we're seeing in terms of the unhealthy natures and the addiction and some of these things can really be curbed by the lifestyle changes and implementing better practices, including physical exercise.
Absolutely. I quite agree. I love what you said about hobbies, and I think it's funny. I've coached a lot of doctors. I used to work for Tony Robbins, and I was the first physician to ever get through the coach training. And I remember coaching a pediatric liver transplant surgeon, very, very super specialized, this kind of really, high stress job with a high death rate of her patients because, it's those kids are really sick who need that. And I remember having a conversation with her one day where we started talking about dabbling, meaning, to do things where you're not going to be good at it, but you just do it for fun. And I think, often people in the medical profession are very intense. We're obsessed from a young age at being the best at everything, or at least trying our best at everything. And it can be quite hard to kind of take a step back and say, I'm going to do an art class, even though I'm terrible and I have no natural talent.
Mm-hmm.
I did a moss art class recently where we created these
Wow.
pictures out of, moss and bits from the garden. And I wasn't particularly good at it, but it was so fun. And it kind of activated a part of my brain, which,
Yes.
hadn't been used for a long time. And I came away just feeling wonderful. And I think, you're encouraging this too. I think hobbies and, finding creative outlets and just doing things where it takes the pressure off and you can just have some fun.
I
Life's
love that
too
dabbling.
short. Yes,
Yes.
absolutely.
Yes. I love that.
Life's too short not to have fun. One of my trainers when I worked for Tony Robbins, he used to say, if you're not having fun, you're doing it wrong. And it's so sensible. I loved all of what you said, and and thank you for the work that you're doing, trying to educate, other people in the profession as well. I think it's so important, and I think what comes across from talking to you is that you love your job as well. I've met so many people in the medical profession who are just going through the motions. They're burned out. They don't really enjoy their job. And I can imagine this is probably particularly high in psychiatry where, maybe you accept your role as a pill pusher and, you just going through the motions, trying to get through the day and not really enjoying your work anymore. But I think when you have that connection with the human being and you want to help them as a whole and make their whole life better rather than just, fixing the mental health problem, it comes across that you love the work that you do. And that makes a huge difference for you and for the patients.
I think that absolutely. I think that more and more, because psychiatry has become more of a competitive residency and competitive field, I'm hopeful that it is going to change into that direction where we're actually mindful of the mind body, spirit connection. We're teasing out some of these, as you say, like pill pusher opportunities to care. And we're looking at the entirety of the individual. I think it's really important to look at every single aspect of their lifestyle, because as you said before, the higher rates of burnout and all of these things. But if you're not sleeping because you're so highly stressed and anxious and worried about your clinical work the following day, how can I help you get the sleep that you need? And some of that is just how do we do that with deep, breathing and meditation and mindfulness techniques? It's just as simple as that. Or what's your wind down process at the end of the evening?
Yeah. This is the perfect place to ask you about about exactly that. What strategies do you personally employ to deal with the stress and pressures of your busy life and career?
I have almost like an organized routine every week. So I can't say that that's going to happen every single day. I give myself grace in that, right? So I'm not somebody who's going to be working 19 hours a day and, wildly successful in terms of that, waking up at 4 a.m. That's not how I work. I think that everybody's very different. Their routines, their bodies are very physically different. And so I'm the kind of person that winds down at, 4 or 5 p.m. at the gym instead of starting my work day or my day at the gym. So I'm doing and incorporating physical exercise at least 2, 3 days a week. That's very important for me. My process of really avoiding burnout really has to do with people around me and ensuring that I am incorporating boundaries, healthy boundaries in my life, professionally, family, friends, saying no to things that don't align. And I think that, again, with our perfectionist tendencies and overachieving tendencies, some people, even towards the latter part of their medical careers, still don't know how to say no. And they just say yes. And that's what leads to their burnout and anxiety and things. But you have the capability to say no. I incorporate at least half of a day a week. That's usually on a Sunday of self-care day. And my kids know it. My husband knows it. My friends know it. Sometimes it will be brunch with my girls, or it could be something as simple as just going out in the backyard and enjoying the setting and reading a book, listening to a podcast, having some sort of like education for myself and for my mind that is a part of, my weekly routines. And obviously, like I have a wind down every evening. I always spend time as much as I can with my family. Um, and, just trying to incorporate as best practices as possible in my own daily life. Mindfulness is a big part of my day. And I incorporate that all throughout the day. That's a little bit of sprinkling through the day
Mhm.
when needed.
I love
With
that.
some frustration tolerance needs to be, sometimes you have to use deep breathing.
Yes, absolutely. My kids are young adults now, but they'd often say to me when they were teenagers, particularly, it's like, Mom, why are you breathing deeply?" And I'm like, they're stressing me out, and I just need to take a few deep breaths. And yeah, and what I got out of what you just said, especially about mindfulness practices, I think sometimes people think you have to do like 30 minutes in the morning, and I've come across this concept too from a book called Peak Mind. I don't know if you've come across that. Amishi Jha. And she says 12 minutes spread over, and it can be spread in like 6 different blocks. So that's just 2 minutes of mindfulness practice can make a huge difference. And I think people often miss that. This is, once you've learned it, it becomes a tool that you can kind of, as you said, perfect
Yes.
wording, sprinkle throughout the day.
Mm-hmm.
Yeah.
Absolutely. Absolutely. You don't need to start your morning off with it and sunrise and have a 30-minute meditation session. It can definitely be sprinkled through the day, even
Yeah.
in your car, having a pause and a mindfulness session.
Yeah.
I had a little bit of that in the morning with a little bit of traffic
Oh,
this
yes,
morning.
absolutely.
So, the music turns down or you have something in the background, practice that, and it's amazing how it shifts your mind in a very positive direction automatically.
Yes, absolutely. And I think what people sometimes miss about mindfulness as well is it, when you practice it, it is then a tool that you should be able to use in those stressful moments as well. It isn't just a practice like brushing your teeth where you do it and it's done, but it has when you do mindfulness practice, it has repercussions throughout the day, and it's a tool that you can kind of use when you're starting to escalate, when you're starting to get over aroused in your nervous system. So I love that. I used to do a therapy called neurofeedback. I don't know if you have experience with it. And when I first started doing that therapy, I wasn't incorporating mindfulness practice, and I had a couple of I worked mainly with severely autistic kids, and I had a couple that weren't responding to neurofeedback, and my supervisor said, "Well, have you taught them to meditate yet?" And I
Mm.
said, "Why would I do that? I'm kind of I'm a physician and a scientist." And she said, "Go and read the research on mindfulness practice." And so I started doing it, and it was really cool because you could see the change happening in
Yes.
the brainwave activity. And it was remarkable. You'd start to see a change between 1 and 2 minutes as quickly as that. And it was like a switch being flicked in the brain. I just couldn't believe it. And that totally convinced me of the benefit of mindfulness practice. So I love that you're using it. And I'm assuming you get all your patients to learn it as well.
I do actually. So if you see, I've got my yoga mat in the
Yeah.
office over here. So we turn the lights off, turn the shades down, and we do some mindfulness practice in here just so that I can show them that it's a really easy tool that they can use at home. If they're escalating or having an issue while in the session, obviously we'll use it as well. But I want them to learn it and really take a step back. I'm not going to send you a YouTube video. I want you to actually learn it and use it and understand that there's other tools that you can use now on a mobile app like Calm or Headspace or some of those that will help you navigate it from a 3-minute session all the way up to, a 30, 45-minute session as you're choosing. But if we can use some of those techniques in the office and we're doing a body scan or whatever it is that we're utilizing, why can't I not show you that so that you can be successful and develop your own subset of routines along the way? So I think that that is very helpful. And I'm loving that, you had experience with neurofeedback because I'm a big proponent of that based on the changes that I've seen previous patients go through. These are not, again, just like sprinkles of innovative tools that are just lackadaisical out there. These are research-based backed tools that with meditation, including your neurofeedback process, however many sessions that is, now you're seeing a lot more of the brainwave activity changes. And you see, like you said, within a minute or two, that change of the arousal, the awake, the, relaxation is automatic. And we have to remind ourselves about the beauty of the brain and its neuroplasticity that we can retrain it. We have tools to do that.
Yeah, absolutely. I share your fascination with the brain. I just think, we're only touching the surface of what we know
Yes.
about the brain. It is a truly remarkable organ, and not it's not it's not intuitive how the brain works. It is a very strange, unusual organ.
Mhm.
It's not there's not much logic involved with what goes on in the brain. So I love that. So before we finish, I'd love you to share with me 3 quick tips on what you would recommend to anybody who wants to improve their health and also live their best lives.
So 3 tips that I am very, very much a proponent of. Number 1 is setting healthy boundaries. I talk about this to everyone that knows me, friend circle or patients otherwise. I am all about healthy boundaries, and healthy boundaries means anything and everything in life. You can have healthy boundaries, setting that up within your profession, in your practice, utilizing these tools in your career ultimately, and finding what aligns with you and what doesn't. And when you feel that, you'll know. And setting healthy boundaries sometimes really is pivotal within your relationships with friends, family members as well. It doesn't end just in your professional career. Um, Other tools is I think we lose some of our genuine nature and our authenticity when we're young and we go through college and we have this mindset that we have to cater to the crowd and whatever else everybody else is doing. What you learn later on in life, which I wish I'd learned earlier, was that being your own authentic self is actually where you stand to be very successful in your life in all aspects, in your mindset, in your relationships, in your career. Because when you utilize your own authenticity, you have the drive, you have more passion in everything that you're doing. And you're not worrying or catering to somebody else or society's roles or your healthcare system, and what they want out of you. And really, the third tool is don't forget about the mind body connection. If you're feeling escalated, if you're feeling that there is something that you really need to address mentally, then you can get support offered from your network of your trusted, supportive people. And if you feel that that is not helping, and you need a little bit more of a support or a mediator, then definitely seeks professional support. There is no stigma against you for that. If you feel like, you're still cautious about it and want it to be very private, confidential, we all have virtual care types of visits and capabilities nowadays. So you're not being seen walking into an office if that's what
Sure.
is deterring you from that. But do not hesitate to seek professional support if you're feeling that something is maybe hindering your progress in life, whether that be mentally or otherwise.
Yeah, that is amazing advice. Thank you so much for sharing that with us today. So tell us, where can people connect with you? And is there anything you're working on right now that you particularly like to share?
I'm always working on something. So there's going to be some great opportunities coming out in 2025, and I'm very excited about. Everyone can follow me on Instagram. It's mona.amini.md is my profile name, and my website is monaaminimd.com. So very simple. I have my own set of 25 non-negotiables for stress detox, and it has some affirmations built in with that as well, if that's something that people like and take an opportunity on that. But really, it's my subset of personal non-negotiables in life. And really, it's about looking at the entirety of the human being and what you can do to be successful in your life.
I love that. That sounds extremely valuable. So thank you for sharing that with us today. So Dr. Amini, thank you so much for sharing your wisdom with us today. It's been an absolute pleasure. We could talk for weeks, I think. So thank you for joining us on the show today.
Thank you for having me, Dr. Rhodes. You have an excellent upcoming year, 2025.
Yes, you too. Absolutely. And to all of our viewers and listeners, thank you so much for tuning in. Please share the podcast with any friends or colleagues who you think may benefit. And finally, I wish you a happy, healthy, abundant rest of your day. See you again soon. Bye for now.